Hi, I'm Olivia Osworth. I'm from Tecumseh High School and I'm a senior this year. I am in nursing prep here at the Tech Center, and today I'm going to be demonstrating how to put in and take out a temporary catheter. I have double-checked the physician's order to make sure I'm doing the right procedure, and now I'm going to check the patient's wristband to make sure I have the correct patient before we begin. Alright, sir, before we get started today, I was wondering if you have any questions regarding this procedure or if you've had one of these performed before. Alright, so you haven't had one of these before. You should expect slight pressure with the insertion of the catheter, as well as the removal of the catheter. You should feel relief of the bladder when the specimen is removed, and you should feel cool wetness with the antibiotic solution to clean the area. Alright, so now we are going to prepare the patient to start the procedure. We're going to make them as comfortable as possible, keep them warm, and offer them as much privacy as we can. So I am going to ask for some help to roll and prepare the patient. So we are going to pull the blankets back. We are going to raise the bed. We are going to take this bed sheet to help make sure nothing gets on the sheets as well as we can to keep the patient clean. I'm going to roll him towards you. Pull your side through. I've got it. And then let's bring him back, get him comfortable again, and let's actually move him towards the center, so towards you a little more. All right, now I'm going to put down this bed rail so I can have an easier access to the patient for the procedure. I am going to begin the draping process to offer privacy and warmth. I am going to move the patient's legs in a way that will help access the field better. All right, now I'm going to place a hazardous waste bag for when I am doing the procedure and have waste that is ready to be removed. I have an easy place to put it while also keeping everything out of the way. And the best place to put this is at the patient's foot of the bed, so it's nice and close to you as well as out of your way. Now I'm going to open the sterile field. When having a sterile field, you must keep everything clean. It is when you have the equipment that is sterile to decrease the chance of infection for the patient. So the first part of that is I'm going to clean my hands. I'm going to open the pack of sterile gloves. The size of the sterile gloves is very important to make sure they are not too big, so they can offer the correct need. All right, now I'm going to open the package, removing the top so it does not inflict with anything in the package. I am going to begin putting on the sterile gloves. Now that the gloves are on, it is important that they only touch other sterile material to make sure the patient does not have an increased risk of infection. All right, now we are going to move the materials necessary for the procedure over to the patient's bed.
Hi, this is Jessica here. I'm going to be walking you through what Liv is doing because she cannot speak while she's doing it because she can't contaminate the sterile area. So now Liv is going to put the sterile pad in between our patient's legs without touching the legs or the bed to make sure that she's staying sterile. Now Liv is going to take the drape and put it around our patient to keep things very sterile. So Liv is now going to take the specimen jar and put it carefully in between the person's legs in case we need to take a sample. And then she is going to open the antibacterial swabs and go around her field, put it into the bag, and then place the swabs in the kit. So now what Liv is going to do is she's going to open the lubricant that she's going to use for the insertion of the catheter. She's going to go around her field to stay sterile. She's going to take the catheter, and for males it is 5 to 7 inches. Now she's going to rub it in.
All right, now it is important to address the patient on what they might expect through these next few steps. So that is what I'm going to be doing now. All right, sir, you should expect a cool, wet sensation when applying the antibiotic solution swabs. And after that, you will feel the insertion of the catheter, which should offer you little pain, mostly just pressure.
So now Liv is going to hold the shaft and she is going to clean outer to inner to stay as clean as possible. Now she's going to grab the catheter and insert it, and the patient should just feel a little bit of pressure as the catheter is being inserted. You will know when it's in far enough because urine will start flowing. Now if she wants to get a specimen, she will do so. Now she's going to remove the catheter. Liv is going to remove the specimen jar. Now she's going to take the tray out, and now she's just going to clean our patient off.
To end this, it is going to be all about making the patient comfortable. So I will apply sanitizer. I'm going to apply a fresh pair of gloves that do not need to be sterile. We are going to remove the top drape. We are going to keep the patient covered. We're going to lay them back down. If I could have Jessica come back and help. We are going to roll the patient to relieve them of the pad. All right, we're gonna roll the patient my way first. You are going to tuck the pad. We are going to bring them your way. Now we are going to make the patient comfortable again and ask them if there's anything we can get them. That is how we insert and take out a catheter.